Hi, I'm Georgina from AC Podiatry. Today we're going to talk about bunions. So they're a very common condition we see in our clinic. So basically, what is a bunion? So a bunion is when we have the big toe starting to drift to the outside of the foot and the long metatarsal bone is starting to drift in towards. So we get this lump on the side of our toe. What that basically is we get this extra bony growth there, and we also can develop a fluid-filled sac. So it can become quite painful. People have difficulty wearing shoes, walking, running, lots of things. So what basically causes a bunion is there's multiple factors. So one can be genetics. So say if your mother had it, grandmother, brother, anything like that, you're more likely to get a bunion. If you're a female, you have a higher chance of having a bunion as well. Footwear, so if shoes that are pointy and narrow, or high heels, so any footwear that's going to put a lot of pressure on the front of that foot. Also, biomechanical issues, so people that tend to have a flatter arch are more likely to develop a bunion. So it's mainly when walking, when that arch gets flattened out, we have jamming of this big toe joint. So we're not able to fully use that joint. And when that happens, we tend to roll off the side of the foot, so going off that way rather than straight through. There's a few treatments that you can do at home to try and reduce some of the pain. One of the main ones is footwear. So just looking into the shoes you are wearing, you want to make sure that they are wide enough for your foot, so accommodating that bunion on the outside. You also want to make sure that you are wearing flatter shoes, so obviously it depends on what type of work you're doing, but if you can just try to reduce the amount of heel that you're wearing, anything is going to help. It's important to have a front rocker on the shoe, so that what that basically does is it helps the foot push through when walking, so it takes a lot of pressure away from that big toe joint. Anything that's not a floppy shoe, so something a lot more stable. We can also do some stretching and strengthening, so we'll just go through those exercises with you now. So first one that we can do is a bunion stretch. So what we're trying to do here is, Abby doesn't have a bunion, but what we're going to do is slide an elastic band around this toe and then slide another one around here. And what Abby's going to do is just try and push her front feet out and pull the elastic tight. So what's happening here is we're just bringing this big toe out and it's stretching the muscle underneath here. So what we need to do is hold that for 30 seconds, relax, do it for another 30 seconds. So we're repeating that 3 times and then trying to do it 2 to 3 times a day. So the next exercise we're doing is strengthening. So what we're going to be doing is strengthening the muscle under the arch. What I want you to do is just try to realign your toe and basically just push that big toe into the ground. So you should be feeling it in the arch here. If your little toes start to scrunch up, just relax and start again. So just bring that big toe out and just try and push down. I want you to try and hold that for 10 to 20 seconds, repeating on each side, so on your left and right side, 3 to 5 times. And if you can try and do it twice a day, that will give you a lot of benefit. So if you're still experiencing pain in your bunion, or if you're concerned, we have other products and services in the clinic. So for an example is orthotic therapy. So basically, when you're walking and you have that flattened arch and you're jamming up that big toe, what the orthotic does is help raise up the arch and allows a lot more movement at this big toe joint. It delays the progression and it helps reduce the pain as well. So thank you for listening today. I hope you got something out of the video. Again, if you're concerned, give us a call and we'll make an appointment and we'll start your treatment program.